which is wonderful and has led to having a lot more CML patients in the clinics, needing their drugs, needing their monitoring. And I think we're probably not alone in Leeds in that, translating into people having to wait in waiting rooms and find that their experience of their treatment can take a little longer. So in Leeds, we have a slightly different way of looking after our stable patients, which we call community monitoring or outreach. And Vicky is our guru in the outreach service, and she's going to talk to you about it.
Thank you. Right. Good morning. My name's Vicky Martin. I'm a nurse on the outreach service. Now, I'd like to say that I could recognise some of your faces. You'll probably know me over the telephone. That's my role. It's done remotely, this role. So please, like Alison says, come up to me at the break and I'll try and guess who you are. I think I've met a couple of you earlier today. So the outreach service, it's an alternative to hospital-based visits. What I plan to do is talk briefly about the outreach service, what it means for the CML patients, the team behind it. I've sent a patient satisfaction audit out, so there's some feedback from that, the challenges for us and the future for the CML patients on outreach. So the outreach service, it's been established now for just over 10 years. It was designed with Dr. Rostron and Dr. Graham Smith, which I'm sure some of you know very well. And it was designed for patients different to CML patients who weren't on treatment, who were typically known as watch and wait. There are about 3,000 of these patients on the outreach. And what the monitoring was designed to do, the outreach, was patients were to receive a pack through the post with blood tubes in and a questionnaire. It was sent directly to the patient's home or to a GP surgery, samples done at the GPs and returned to the HMDS labs. So it took away that need for clinic visits. Very successful. So the CML monitoring was trialled in 2013 and then rolled out to patients in 2015. We've got about 40 CML patients active on the service at the moment. We've had about 50 since 2015. Some have gone back to clinic, tried the Destiny trial, and now back on outreach, and some are de-escalating as well. So some of the reasons why outreach is successful for CML patients, we've looked at this morning the several treatments that have been successful in getting this, the deep, stable MMR, and which enables patients then to be able to be monitored, not directly in clinic. So the advantages to the NHS are that they would reduce the clinic slots, advantages to patients, that it's more flexible, you don't have to sit in really busy clinics, it's more convenient to yourselves, you don't have to trail around the car park. And then you've got one point of contact, which is myself, although I sit within a team and I'll talk about that a bit later on. But also at the same time, if at any point patients have access to a doctor back in clinic if they so wish or the need. So what does it involve? Briefly explained, small pack is sent to the patient's home, just fits through the letterbox, although we can send it to the GP practice if there's a problem. The blood tubes and questionnaire are in that pack. Bloods are to be taken at the GP surgery, although you can go to a drop-in centre at your local hospital. Some people even go to the supermarkets, tie it in with that. It all comes back to us at HMDS. At that point then, the bloods go through the labs, they're analysed, and then myself and Dr. Rostron look at the results and any symptoms that might be being experienced. If there's any abnormalities, then we would either repeat the sample or perhaps a clinic visit might be needed. A report is then generated, a copy goes to the GP and yourself, and prescription. If you're on treatment, then a prescription can be organised as well at that point. Something in the feedback I'll come to later on, a patient were asking if prescriptions can be done via the GP. Well, the drugs that we've been talking about, they're classed as red flag drugs, and they are started in specialist centres, and they have to be continued to be prescribed in specialist centres. I know it would be easier, wouldn't it, if you go to your GP, and some people have a monthly and they tick all the boxes, and it'd be nice to have that on the bottom, but unfortunately they have to be done still through us, the red flag drugs. And then there's a home delivery of medication. That's the report that you would expect to receive. The top right is the report. We've magnified it so you can see a bit better, but there's the graph of the PCR on the right-hand side, where the pink, yellow and the green is. And so hopefully you'd have your PCR measurement deep down in the green. And then the left-hand side is the full blood count. So you've got your hemoglobin, platelets, your kidney function. And then that's also shown in a number. You can see your numbers, your HB, what your normal range should be. And then it's in written text as well. But if still after that you don't understand, you can always give us a ring and we can talk through that. So the points to consider for the outreach monitoring, it's been going for many years now, so it's an established system and it's shown to be effective. The criteria, you have to be at least in a major molecular response for at least 12 months and no major symptoms. And at any point, patients can switch back to clinic if they feel that they would like to do all that. We've been monitoring patients on TKIs and interferon, post-Destiny trial, and also we're doing a few patients at the moment on de-escalation trials, so their monitoring is more frequent. On referral to us, I try and speak to the patients just so that they can become familiar with the process. And the idea is to have 3 packs a year and then an annual clinic review. So the team behind it, lots of different members of staff, including the GP surgery, the admin staff, Carol in reception and the secretaries who take messages. And then we sit also within the laboratories and also within the haematology team. So we have access to Alison and Dr. Rothwell and the other haematology consultants. So when Dr. Rothwell asked me to do this talk, I took the opportunity to send out a patient satisfaction questionnaire. I sent out 40, I got 20 back. One patient wasn't entirely satisfied, and I've been back in touch with them, and I don't think it was entirely outreach related, but we will. However, we'll be able to overcome that, and that's the feedback that we had. So overwhelmingly, it seemed to be quite a good service. That's the red. That's I can't. Everybody can't just be green, can it? So I think just for that person, just an increased, a different kind of monitoring, maybe increased contact, will hopefully turn that to green for next year. And some of these are the comments that we had back. So thank you. I'm glad it's working for the majority of people. Well, now the challenges that we've got, prescriptions are new to the outreach. When outreach started, they were just really watch and wait patients. So it just meant a lot closer attention really for us. But if people are on medication, if they get to feel that their medication's running low, can you let us know, and then we can solve that problem. A prescription should be prescribed at the clinic review as well as at each pack return. Interactions, I think it was mentioned in one of the earlier talks, the GP should know that you're on one of these red class medications, but it's just to bear in mind if you develop other conditions, it might be helpful just to let us know. Effects from medications that need monitoring, again, that's something new for the outreach that we've had to become familiar with. And again, if you develop a condition, for example, shingles, and you started on acyclovir, it might be useful just to note that on the questionnaire because it can affect the salts. Potassium and magnesium, they haven't always travelled so well, and some of you might have had to have repeat samples. That's still something that we need to look at, where those samples are going to be taken. They don't like travelling in the heat or the cold, and so it can affect the levels. And then the late pack returns. I will get in touch with people if packs aren't returned on time. We have a work list that we regularly check. And then, of course, if people miscount stocks of medication, it can have an impacting effect. And so the future for CML monitoring, in the feedback, somebody asked for more online communication. We can email the reports to patients, but that's not an automatic process. But I'm happy to put that on the patient notes, so that can be arranged. We anonymise the report. And improvement on the prescription management. I've just completed my nurse prescribing, so the next few months it should be me that's doing the prescriptions. And hopefully it will speed up all this process of getting the medication delivered. And hopefully as there's more and more people in MMR, we can bring them onto the outreach. And that's a reference for the outreach that was started back in 2007. Now, put any questions, but I don't know if I'm allowed questions. Not yet. We've got time.
I think the satisfaction data there is astonishingly good, something you should be extremely proud of. And the last session before lunch